Lymphedema, or soft tissue swelling of the head and neck, is common after illness, allergies, or treatments for throat cancer, whether surgery and or radiation therapy. Although compression is commonly used for arm and leg lymphedema, compression is not possible for the head and neck area. Rather, lymphatic massage is utilized instead. Beyond massage, exercise is extremely important as muscles act as a pump to stimulate and squeeze the lymphatic vessels to get the fluid moving out. In this video, we will focus on lymphatic massage. Performing the massage first thing in the morning is best for head and neck lymphedema because laying flat all night negates gravity's influence in helping to keep this region drained when upright during the day. So the overall goal of manual lymph drainage for head and neck lymphedema is to get the fluid moving out of the head and the neck area and down towards another region like the chest and the armpit areas. Make sure to use as much of a flat hand and your whole palm and all of your fingers, not just a couple of fingers or your fingertips. You want to try use as much surface area as possible against your skin to get the most benefit. Using lotion or any type of massage oil is helpful as well to minimize skin friction. And it's best to perform lymphatic massage sitting upright instead of laying down in order to take advantage of gravity to move the fluid down and out of the head and neck area. Do not perform lymphatic massage in any area that is painful or if you have any new surgical incisions or scars that are not fully healed. Otherwise, you risk opening up the wound. So before we begin, make sure you take deep breaths in and out using your diaphragm, also known as deep belly breaths. Make sure you continue taking these deep breaths during the massage sequence. Where we're going to start is we're going to start just above the collarbones. You can do like this. You can also take one area at the time and just 10 rounds. Again, using as much surface as possible with a flat hand. And going in small little circles. Again, not a lot of pressure is needed. You split your fingers and we're going to move up towards the ears and the neck. There's a lot of lymph nodes around the ears and under the jaw. Again, doesn't need to be very hard. Just gently stroking, opening up. And let's do under the chin. Making sure that you're breathing. And then moving on to the back of the neck. Massaging downwards. Moving on to the chin. Again, sending it to the ear and down. And I'm going to go into the upper lip. and around the nose. Sending it out to the ears and down. Always think away from the center and down. And a little bit on the upper lip. Away from the center and down. And then moving up to the eyes. Just doing very gentle circles. Again, you don't need to put a lot of pressure. And going the opposite way. And just giving a few pumps here in the center, following down the nose. And again. And away from the center and down. Up to the forehead. And again, continue going from the center and outwards. And then moving over to the sides of the face, kind of following your cheekbones. So very gently, just again, sending it out to the ear and down. And then let's do an overall with your entire hand. Very gentle pressure. Away from the center and down. And if you still have a specific area that needs a little bit more attention, such as your under eyes, feel free to spend a little bit more time here. Always thinking, starting in the center, going out away from the center, and then leading the fluid down. And then final thing is just to give a little bit to the chest and the upper part. Small, gentle circles. Again, using as much flat surface as you can with your hand. Guiding the fluid towards your armpits. It's best to do this lymphatic massage sequence every day, especially in the morning and in conjunction with exercise. Thank you for watching.